Hi, it's Dr. Rankin with South Metro Wellness Videos. Welcome back to my channel. I was just informed that today is our 40th video, so if you've been tuning in and watching us, thank you so much. If you're new, I hope you enjoy this video. Today we're going to focus on, once again, young people and correction and posture and what happens with shoulder stress and tension and how it affects your posture and your overall spine and some of the things that we can do for free at home to help combat that stress and correct it. Once again, we've got our friendly spine here, which is our teaching tool today. I want to remind everybody that last video we talked about the cervical spine and about head posture going forward, and this is an extension of that with our mid-back posture going forward. So as a reminder also too, stress is exponential. It's cumulative in a different way. Today's stress doesn't add to tomorrow's stress as 1 + 1 = 2. It's more like 2 to the second power, which is 4. 2 times 2. That math doesn't exactly work out, but 2 to the third power, exponential. You get it going on down the road. So it accumulates much more quickly than we think. Most people think that they have pressure and stress in their upper back and their body back here because of how much they use their shoulders, how much they write, and how much they use their arms. However, if you take into account your small muscles and how much they work for us when your head is far forward, or if your shoulders are rounded, or if you are a person who's on the computer or using a phone a lot, your ears and your shoulders kind of meet. So you ever have to tell yourself during the day, why are my shoulders so tense? Just let them go and your posture completely changes. So in order to help people fix some of those postural imbalances that literally look like this, getting the head back over the shoulder is the first part, but then again, we have to exercise it. So I'm going to put my friendly little spine down here. Hopefully it doesn't fall. It's got a happy home right there. And we're going to focus right over my head, my ears here at the cherry blossoms, and we're going to practice what's called a wall posture. So I teach every new patient this about their second or third week of care. And it's once their body starts to change with their adjustments, how do we actually get it to stick, right? Because that's chiropractic. Make it stick, right? So the first thing you want to do, take a nice big breath in, let it all the way out, and then get your body up against the wall. So you're going to focus on getting your heels, the back of your glute muscles and your hips, your shoulders and your head all the way back against the wall. The key to this one is anatomical posture, so your hands are going to be correctly face up, and I want you to put those all the way up against the wall and look right straight ahead. Okay, you're going to just relax and kind of melt into the wall. Remember, this is plumb line, 180 degrees straight up and down. Okay, so I'm going to give you guys some body landmarks here. When you're done, if you're practicing this at home, remember to breathe. It's really easy to feel awkward. If you feel awkward and you don't quite know what you're doing, that's a good thing. That means you're doing it correctly, I promise. After about 20 seconds, you should be feeling pretty one with the wall, right? And very carefully take one step or a step and a half, a big one. If you're short like me, try to take a bigger step forward. Okay, you're going to take that step forward and you're going to hold that posture. You might have to just make a little bit of an adjustment here. Okay, I'm going to turn to the side here very, very gently. Okay, so what you're going to be looking for is the chin is going to be tucked. So a lot of folks who have this, I like to call it that swan necking out posture. Okay, they're going to have to really have their head up against the wall and their chin's going to go up. That is incorrect. You want to have the chin tucked. Chin wants to be tucked. Your natural, God-given, normal posture is not like this. It's down here like this. Okay, very soft and very subtle. Looks very confident, very straight when it's all said and done. Your ear is going to be over your shoulder. Your shoulder is going to be over the hip, right over here if you can see. The hip is going to be right over the knee, which is going to be right over the bump in your ankle. Okay, so when all of that stuff comes together, this might not all be visible on camera, but what I want people to see is what my shoulders look like. My posture doesn't look like this. Check your posture in the mirror. Have a friend do it. If you suspect that your mid-back is rounded or stressed or hurts all the time or is just kind of tense and kind of sore, you're right, it probably is. And it's because you're normally like this or normally like this. You've had neck pain, you've had headaches, maybe you've got clenching in the jaw. Okay, those are some other things people need to focus on. Your posture should look very straight up and down. Okay, when you look to the front, in the center, okay, there shouldn't be any tilting within the ears. The ear should be nice and even. Okay, your chin should be right over top the bone here in your chest. We call that the sternum. Okay, so if you feel all of your ribs up here, your sternum here is right in the middle, your chin should line up Should be right over your belly button. Everything should be nice and even. Okay, this posture is going to feel very awkward and very weird because it's normal and it's correct. If you've been walking around with a heavy backpack for 4 years or 6 years as a college student, if you gave birth and you carried little kids on your hips for a while, okay, maybe you just do a lot of heavy lifting at work, maybe you have a computer job, whatever it is, your posture is probably suffering from abnormalities that many of us are suffering from, and because you get used to it and it's a gradual development over time, you forget what it looks like. Check your own posture. Be honest. Your nervous system is trained to recognize a normal that is not working for you. Okay? So your chiropractor's job is to help teach you how do you make those adjustments stick and how do you actually work with this. When I was 25, I went through postural correction. That was 10 years ago now. My posture has been corrected and it has stayed corrected because I continued to exercise it. The wall posture is free, easy. You do it at home. When it starts to wear off, you do it again. I remember doing this guy 3 times. 3 times per day. It was about 30 seconds. I'd hold up here against the wall, take a nice step forward, turn it to the side, keep those palms up, keep the chin tucked, keep everything nice and straight. And that is how you know you're being successful with your wall posture. Okay? A lot of my patients will ask, we'll go back over, we'll recheck it, we'll see if they're actually exercising it now. As you've noticed throughout the video, my posture didn't slump, it didn't go forward, it has maintained normalcy. Yours will do that too. It's just going to take a number of weeks before that posture starts to feel normal. Again, as a reminder, postural corrective exercises are supportive. They're going to help your body correct and make those adjustments stick. Without your chiropractic care, however, your exercises will not be nearly as effective. The true reason that is because when we do the chiropractic adjustment, we're taking all of the pressure off the nerve so that your innate intelligence can tell your posture where to go. Okay, your body does know what to do. You just have to give it enough nutrition and enough exercise and enough chiropractic adjustments to make it work. It will be nearly impossible, and I have a lot of folks do this. If my shoulder's down like this, can I just start doing this? Will they go back to even? The answer obviously is no. I'm not trying to make a joke out of that, but many people of all ages will say that. Young people will say, oh, I'll just stand up really straight, but gosh, doc, it just really doesn't work. There's a reason it doesn't work, and there's a reason your body gets tired and achy and sore trying to do it that way, because your nervous system is not being corrected from the inside out. Remember, postural corrective exercises are something that you do to work with your chiropractic care. It's something you can do in between chiropractic visits, but it will not take the place of your chiropractic adjustment. It is a myth for anyone to believe that it will. So keep those things in mind. If you're struggling with your posture, remember, see a local friendly chiropractor for a free exam or a free consultation. Many times that's an interview. Yeah, there are 2 different types of chiropractic. As you guys who've been tuning in for the last 40 videos, you know that this is about correction, it's about change, and it's about making those changes stick, not just doing pain relief exercises. Okay, so with that, I'll say stay safe out there. Thank you for tuning in. If you guys need us, you can just go ahead and drop us a message on Facebook. Go ahead and do a submission on our website, southmetrowellness.com, or give us a call, 952-892-5006. If you haven't seen a chiropractor before and you're interested in coming to us here in Burnsville, we'd be happy to see you. We're open 5 days a week, Monday through Friday. Once again, 952-892-5006. Thank you. It's been Dr. Rankin. We'll see you next week.